Hey guys, so in today's video, I wanted to give you guys a little bit of an update on how my appointment went with my primary care doctor yesterday. I had made a video kind of explaining that my liver enzymes were elevated and I ended up in the ER a couple days ago, day before yesterday. And yesterday I had to have a follow-up appointment with my primary care doctor in order to see if he felt like it was safe for me to work the rest of this week. He actually, today is Thursday, he has me off of work until at least Tuesday. And that is dependent on if my liver specialist feels like it is safe for me to return to work on Tuesday. So I am extremely stressed out. This is not what I needed to have happen at this point. It's very frustrating to have a chronic illness and have to deal with medical conditions in the first place. And I kind of vented a little bit of my frustrations in that video where yesterday I filmed a video kind of explaining how freaked out I was after everything happened in the emergency room. And I am just trying to take it day by day. So I am still dealing with a lot of pain. I did have some additional blood work done yesterday that my primary care doctor ordered, and not all of it has come back yet. My liver enzymes are still elevated, so it's definitely a good thing that I am getting in to see the liver specialist as soon as I could, which was Monday at 3 p.m. It's just very stressful. Like, I have been worrying and stressing myself out, trying to figure out, like what is going on, what could have caused this to happen. I'm just very thankful that I have not had to return back to the hospital. Like, I also think it's sad that even my liver specialist had mentioned, like, if you have to go back to the ER, please don't return to the ER at the hospital where I work at. I think it's sad that, like, even specialists at other healthcare facilities realize exactly what's going on at the hospital that I work at, which is really sad. Because I've had multiple negative experiences dealing with this liver condition. And I don't know if I ever gave a full explanation of what is wrong with my liver. So for those of you who haven't watched any of my previous videos talking about the problems that I had back in March of 2024 with my liver, it was actually discovered that I have a chronic autoimmune condition that causes my immune system to attack my liver cells, whether they are healthy or not. And basically, my body is wreaking havoc on itself for no apparent reason. So it's basically one of those things where we kind of have to watch and wait and see if these things continue to happen, which is extremely frustrating when you are the person who has to deal with these things, because I am the person who is having to deal with the ramifications of not having a treatment right now. And like, I realize that I am stressing out my godmother, I'm stressing out her sisters, because like last night, my godmother thought that she heard me get up at like 4 a.m. And my primary care doctor had actually prescribed me some pain medication yesterday. And so I picked that up and I took one dose of it, and I actually slept okay. Like, I woke up a few times because my Dexcom was going off and my blood sugar was really low, like it was in the 40s. So there was a few times last night that I did wake up because of that, but for the most part, I slept better than I have been sleeping, so that's a positive anyway. But it's just very frustrating. Like, if you've never had to deal with a chronic health condition, I pray and I hope that you don't, because this is an extremely frustrating thing to have to go through, I mean. And it's very stressful when you don't know exactly what's going on and there's no explanation for why. Because like I said, up until I passed out on Monday, or Tuesday, sorry, Monday was Labor Day. Ever since I passed out on Tuesday morning, up until that point, I felt fine. Nothing felt off. I woke up, did my normal morning routine like I mentioned in that video. everything was normal. It was just a normal day, like going through my normal everyday routine. And then all of a sudden I pass out in the midst of trying to work on homework for my classes. And, I don't know what else can be done at this point. I'm going to talk to my liver specialist when I see her and like ask her, where do we go from here? Because I don't really feel comfortable just kind of sitting and watching and waiting. And I know like she is a little bit hesitant to start doing things because it could actually cause damage. Um, but I need some sort of relief from having to constantly worry about this happening again. And that is one of the reasons why I was so frustrated when she said that we couldn't do any treatment right now, is because, like I said, so we're basically just watching and waiting to see if I end up in the hospital again. And that's basically what we're doing. We are sitting and waiting, seeing if I end up back in the hospital. And thankfully, this time it wasn't bad enough that I needed to be inpatient, but it was something where, they wanted to make sure that I was seen at the next available open appointment slot. So I don't know, like I'm just extremely tired of having to struggle with this. I'm extremely tired of having to take time off of work. And I'm just extremely frustrated with this whole chronic illness thing. I just wish there was some way that I could fix this and make my body like itself again, make it stop fighting my liver cells for no reason. Like I had weight loss surgery in order to try to become more healthy, and I was doing fine. And now all of a sudden, out of nowhere, my liver enzymes are elevated again. My primary care doctor also ordered some antibody immunoglobulin testing that I had done when I was down inpatient at the other hospital where I had my liver biopsy at. And those results haven't come back yet because they do take a few days to get results. But I'm hoping they come back before I go down to see my specialist on Monday, hopefully. But yeah, other than that, it's just very, very stressful, frustrating. It's a process that I'm sick and tired of having to go through. I probably will not have any other updates until after I have spoken to the liver specialist, just because, unless something else happens and I end up in the hospital again or having to return to the ER, I don't really have anything going on as far as answers or anything like that. He did also order another lab that basically shows like whether you have liver or tissue damage, or not liver, organ or tissue damage. And that came back high, which shows that I do have organ or tissue damage within my body, but it's kind of a non-specific test. So it shows that there's some sort of tissue damage or organ damage, but it doesn't specify like where. Those numbers can also be high if you have different types of cancer. And so like, I just feel like we're going back into a loop of trying to figure out exactly what's going on. And it's extremely frustrating at this point because, yes, I have an autoimmune condition, but now like this is happening again and I don't really know what to do to help it. So I just thought that I would give you guys that little update on how my primary care doctor's appointment went yesterday. And like I said, I am off until at least Tuesday. Hopefully I'll be able to return to work on Tuesday because I can't afford to keep taking time off of work. I do have bills to pay and things like that. So I'm hoping. Keep me in your thoughts, and I will talk to you guys next time.